Flora Mugisa is a 70-year-old who got infected with tuberculosis 5 years ago as she attended to her ailing sister. She was given medication but did not take it as prescribed by the doctors. Mugisa eventually developed the mild drug-resistant TB.
Nyamiraga bwiro bunkagondeizeho kugenda kugarukayo kunkebera bakasanga bulimu ngugarukam nabona uko nakoze.
And so if a patient has a strain that even when those drugs are present, it does not die, that means he's resistant to TB.
Authorities at Hoima Referral Hospital couldn't detect or treat Mugisa's condition because they lacked the equipment. She had to be referred to Mulago Hospital. Her condition improved at Mulago Hospital after 2 years of treatment. Mugisa is among the few rural dwellers who can afford to travel to Mulago for treatment. Many of her village mates with mild drug-resistant TB have resigned to their fate.
By the time patients reach Hoima Hospital, they have already traveled some distance in the region, and these are not rich people. Now, when you send them to Mulago, it is far, it becomes complicated for the family to look after the patient. It makes it difficult, so they end up not going.
Unfortunately, such people do not only put their life at risk, but also expose others to the risk of contracting the wild bacteria that is resistant to drugs.
So as part of our policy, we decided to do a rapid expansion of MDR treatment facilities and primarily designated regional referral hospitals.
The Ministry of Health and a global health non-profit organization called Management Sciences for Health is working on increasing the detection of TB cases, improving treatment outcomes, and controlling its prevalence in the country.
We are implementing 100% directly observed treatment. That means the patient gets started on treatment and either is observed by a health worker or a family member.
And we have made sufficient provisions in terms of the budget to ensure that we have all the TB drugs all the time.
This is the newly renovated mild drugs facility in Hoima Referral Hospital. It's meant to serve people from 7 districts of Chibale, Hoima, Masindi, Bulisa, Kiliandongo, Chankwanzi, and Chiboga. Health experts at the Ministry of Health estimate that there are about 1,000 drug-resistant TB infections each year in Uganda. Over 613 cases are being treated since 2012. It costs 13 million shillings to treat a patient with TB that is not sensitive to drugs. The treatment takes 2 years, yet it only takes 6 months to treat the sensitive TB. Irene Namialo, NTV, Hoima District.